Hey there and welcome. So today we're going to tackle a topic that affects millions of people but is, often really misunderstood: mood disorders. This goes way beyond just feeling happy or sad. We're talking about real medical conditions that can deeply affect a person's emotional state. So let's try to bring some clarity to it all.
I mean, it's a question a lot of us have probably asked ourselves at some point, right? That feeling when a bad mood doesn't just last a day, but it sticks around for weeks? Or maybe when your energy levels feel completely out of your control. We're going to explore that line between everyday emotions and what it means to have a clinical mood disorder.
All right, so here's the game plan for this explainer. We'll start with the absolute basics, then we'll get into the different types and what they look like. We'll also cover the science behind them, walk through what treatment actually involves, and wrap up with how to live a full and meaningful life. It's a clear path from A to Z.
Okay, let's jump right into section one. Because, to really get a handle on mood disorders, we've got to start with what they are, and just as important, what they're not.
So let's break that down. The key words here are intense and last for weeks or longer. We're not talking about a bad afternoon. And maybe most importantly, they interfere with daily life, your job, your relationships, just the basic stuff. That is the huge difference between a mood swing and a mood disorder.
So here's a simple way to think about it. Our brains have this whole communication system running on chemicals, neurotransmitters like serotonin and dopamine that help manage our mood. In a mood disorder, that system kind of gets out of whack. It's so important to see this as a biological issue, not some kind of personal failure.
And that leads us to maybe the single most important point in this whole section, and it's worth saying again. A mood disorder is not a character flaw. It is not a weakness. It is a treatable medical condition, period. Just like asthma or diabetes. All right, so we've got the basic definition down, but what does a mood disorder actually look and feel like in the real world? Let's get into the specifics. Okay, so here's a quick look at some of the common ones you'll hear about. You have major depressive disorder, which most people just call depression. Then there's the whole spectrum of bipolar disorders, which are known for those swings between highs and lows. And you also have more specific types, like persistent depressive disorder, which is like a long-term, low-grade depression, and even seasonal affective disorder, or SAD, which is linked to the changing seasons. So let's really zoom in on the two opposite ends of the spectrum here. On one side, you've got depression, this persistent sadness, a deep, draining fatigue, and just losing interest in things you used to enjoy. Then, on the complete other side, you have mania or hypomania, a super elevated mood, barely needing any sleep, and thoughts that are just racing. They're polar opposites. And this brings us back to that really critical question. When does it cross the line from just feeling bad to being a disorder? Well, it's when those symptoms stick around for weeks, when they cause real suffering, and when they seriously get in the way of you living your life. That's the clinical line in the sand. Which, of course, leads to the big question, right? Why? What actually causes a mood disorder to develop? Well, the science tells us it's rarely just one single thing. It's usually a pretty complex mix of factors. It really boils down to three main areas. First, like we talked about, there's brain chemistry. Second, genetics definitely plays a part. These conditions often run in families. And third, really tough life events. Things like trauma, major stress, or a big loss can act as a trigger. It's a mix of your biology and your life story. And I'm going to say this again because honestly, it can't be said enough. When you think about the fact that this is caused by a mix of your brain chemistry, your DNA, and things that have happened to you, it becomes clear that it is fundamentally not your fault. And that's not an excuse. It's a message of empowerment. Okay, now for what is maybe the most hopeful and important part of our whole discussion. Getting a handle on the problem is step one, but step two is knowing that there are real, effective solutions out there. The good news is mood disorders are highly treatable. The idea of getting a diagnosis can sound really intimidating. So let's kind of pull back the curtain on what that process actually looks like. It usually starts with just talking to a doctor or a therapist. They'll use some standard questionnaires, maybe do a physical exam to make sure nothing else is going on, and then they use official criteria to make a careful, accurate diagnosis. It's a really thorough process. So, once there's a diagnosis, the treatment path usually involves a couple of main approaches. There's medication, which can help get that brain chemistry back in balance, and then there's psychotherapy, talk therapy, which helps you build skills and change patterns. And actually, for a lot of people, the magic bullet is a combination of both. So, just to give you a quick snapshot of what some of these medications look like, for depression, you might see things called SSRIs, like Prozac. For bipolar disorder, a cornerstone of treatment is often a mood stabilizer like lithium, which has been a gold standard for a long time. Of course, this is something you'd figure out with your doctor to see what's right for you. And then you've got the therapy side of things. One of the most common and effective types is something called CBT, or cognitive behavioral therapy. The idea behind it is actually pretty simple but super powerful. It helps you learn how to spot and challenge those negative thought patterns and gives you real practical tools to cope with your symptoms. All right, so let's shift gears and talk about real life, day to day. Getting professional treatment is the absolute foundation, but building a lifestyle that actually supports your mental health is just as crucial for feeling good long term.
Think of these as the tools you can put in your own personal toolkit for managing your well-being. Things like having a good support system, taking care of your body with good sleep and exercise, finding healthy ways to deal with stress, maybe even tracking your mood to see patterns. And, of course, the big one, sticking with your treatment. These really are the building blocks.
And hey, if medication is part of your treatment, there are a couple of really critical things to keep in mind. First, be patient. These meds can take a few weeks to really kick in. And second, be consistent. Suddenly stopping or skipping doses doesn't just make them less effective, it can actually be dangerous. Always talk to your doctor before changing anything. Okay, we absolutely have to pause here for a second and talk about something incredibly important. Because sometimes it's not about long-term management. Sometimes it's a crisis, and you need to get help right now.
This number you see here, 988, is the Suicide and Crisis Lifeline. I want to be crystal clear about this. If you or anyone you know is thinking about suicide or self-harm or is just in a severe crisis, you can call or text this number. It's free, it's confidential, and it's available 24/7. Help is always there. Wow, we've covered so much ground today, from brain chemistry to treatment plans and crisis support. But it really all boils down to that first step, understanding. So I want to leave you with this question. Thinking about everything we just talked about, what's one small thing you can do today to support your own mental health, or maybe to help out someone else? Thanks for joining me.